My name is Luc Pierard. I am currently Professor of Medicine at the University of Liège and head of the Cardiology department in the University Hospital of Liège in Belgium. And I am co-chairperson of the Focus Committee, and we will discuss together with Professor Eeckhout, also co-chairpersons of the Focus Committee, and who is cardiologist in Lausanne in Switzerland. Since the beginning, two kinds of focus sessions, what is called the Focus Cardiology Practice and the Focus Imaging Interventions. Could you explain the difference between these two kinds of sessions?
Okay. Well, the key objective of Focus is case-based learning. We have seen on several occasions for people who engage for the first time as a faculty member in Focus that they don't really get the clue of what is expected from them. It is really based on a case, a clinical case, that is presented by the presenter, mostly 3 cases per session, 90 minutes. And the presenter has to put this patient in a perspective of current knowledge, guidelines. Very important to implement the guidelines in this concept. And there is a lot of interactive discussion between the both chairmen, 1 or 2 chairmen, and the 3 case presenters. In the Focus practice, it is rather, I would say, general cardiology practice for the general clinical cardiologist. That can be management of atrial fibrillation. It can be looking, that will be done this afternoon if I'm not mistaken, looking into difficult ECGs, always very popular sessions. The imaging or intervention part of Focus is rather, I would say, based on imaging, and imaging is becoming more and more important during intervention, so it's linked to intervention. And we have at this meeting a session on percutaneous valve. We have sessions on the mitral valve, as you know very well. So it's clearly different, and also the format. Although it changed this year, it was a surprise for me to find the chairs. But in Focus practice, mostly a panel, half circle of people sitting together and discussing. Until this year, Focus imaging and intervention was a classical table with chairs and panelists. I found for the first time this year that we were also sitting in a half circle, and I must say, even for the imaging or intervention part, this circle principle and this, like we sit here today, it was very, very nice for me as a faculty member to participate. Since the beginning, it's a company called Media Ventures from Belgium who is involved in the technical part. So this whole group of people travel across Europe. For example, if we have transmission from far away, they go on site, they take care of all the linking satellite connections. So this live part, as in many congresses today, is taken care of by this company. If you visit the Focus area, you will be surprised by, it's very nice to be there. The light, the atmosphere is very, we don't see it at other sites. It's really very well done by these people, and I must say that the image quality, they were amongst the first to use high definition television for live transmission. So I think the quality of the sessions, the technical support at the sessions certainly play a role in the quality of the session. And yes, most of the Focus sessions are almost 100% attended.
So they are transmitted live from satellite. There is high technicity, so I suppose it is rather cost and expensive. Can you talk about the current mode of sponsorship of these sessions?
Well, I would say times are a little bit hard. As you know, things may change a little bit. Principally, companies are requested to support these sessions by an unrestricted grant.
But they are not supposed to grant for a specific session in their own area of interest.
No, it's not allowed, and I think it's very logical. I remember that 2 years ago we made a very nice video movie to promote Focus, but despite the fact that the Focus sessions are very popular, the industry may not always know what Focus is all about. and this was sent out to the industry, and he had a quite good return on investment. There was a lot of interest. This year it seems to be a little bit more difficult. I think also the economical circumstances can play a role in that, but it's important if the industry listens to me that it's not a waste. It's really an investment in objective learning, case-based learning for the general and also for the subspecialty cardiologist.